On this episode, we'll talk about extending your pre or post-op diet beyond the recommended duration. We'll talk about if the gastric sleeve can help with insulin resistance, and does birth control stop working after weight loss surgery? Hello everyone, I'm Dr. Alvarez with Endobariatric.com. Welcome to episode 245 of the Ask Dr. A show. Thanks so much for sending me your questions, and that's what the show is all about. By the way, I need questions, so send me your questions regarding gastric sleeve, regarding weight loss surgery. Send me your questions. There's one way to do so, using the hashtag AskDrA right here above me. Use the hashtag, otherwise we can't get to those questions. And I'll add them here to the list. More than happy to be here to answer them for you. Also, you might consider hitting that subscribe button down there. That way you won't miss out on any of our future episodes. Let's get into the show. All right, so our first question is, which is unusual, but not that unusual. I've had it before. Is I want to go beyond the recommended duration of the pre-op diet. Patient that is instructed to do a pre-op diet for 10 days or 5 days, and I want to just do it for 2 weeks. Can I do it for 2 weeks? The answer is yes, you can. This also applies for the duration of the post-op diet, and we do first week of clear liquids, and then week 2 and 3 of full liquids, and then we start eating. When it's time to start eating, I sometimes encounter patients that are fearful to start eating. They think that something might go wrong, that they just might want to go an extra week of doing liquids. Is it recommended? No, I mean, it's healed by that time. Can you do it? The answer is yes, you can do it. Nothing happens. You can go an extra week, or you can do a week prior to your pre-op diet. That would be just fine. Nothing happens. Your body will adjust perfectly fine. But trust your doctor. When the doctor tells you it's time to eat, it is healed, it's time to eat, because you can't be on a liquid diet for the rest of your life. That's not the intention of the procedure. The procedure is intended for you to have a better quality of life, for you to live life, a better life as well. And when it's time to eat, enjoy, and we can start eating. Second question is, it's a really good question, and I want to know if a gastric sleeve procedure can help with my insulin resistance. The answer is yes. It will definitely help your insulin resistance. We get a lot of patients referred to us by endocrinologists, by OBGYN, doctors that have patients with insulin resistance or PCOS. And I did a whole video about this. We posted this video last week. You might want to check it out, or I will link it down on the description below, because it just talks about this specific question. And the answer is yes. A gastric sleeve will definitely help insulin resistance. On that video, I talk about the mechanisms, how the gastric sleeve will help a patient with insulin resistance specifically. And the last question is, does birth control stop working after weight loss surgery? The answer is no. No, there's no data out there that will tell you that birth control will stop working. Actually, the contrary. Once you start losing weight after weight loss surgery, you start losing weight, your hormones get into tune, they start working better together, they start working in your body in a better way, and normally birth control pills help even better. I mean, they work better. But to tell you that they stop working, the answer is absolutely not. All right, so there you have it. Send me your questions. I need your questions. Don't forget to use the hashtag AskDrA. Hit that subscribe button. And if you enjoyed the content, if you can help me with one of these, I greatly appreciate it. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.